The next hallmark will be genomic instability. So genomic instability is, I already mentioned when we were discussing P53 also. So the DNA repair is not going to be proper here. So once the DNA repair is defective, it is going to lead to lots of mishaps causing genomic instability. So under that, the DNA repair defects, we are going to see different types of repair. Firstly, we have nucleotide excision repair. So whenever there is a UV rays, it is going to damage the DNA by forming pyrimidine dimers. The UV rays are going to form pyrimidine dimers in the DNA that causes the DNA damage. And these pyrimidine dimers are normally corrected by the nucleotide excision repair. Okay, so whenever this nucleotide excision repair is defective or mutated, it is going to result in something called as xeroderma pigmentosa. So xeroderma pigmentosa is a syndrome in which there is going to be risk for developing skin cancers, especially BCC. Okay, BCC is basal cell carcinoma. So the next type of DNA repair is going to be homologous recombination. Again, UV rays can damage the DNA by producing either a double-stranded DNA break or a covalent DNA crosslink. So pyrimidine dimers are corrected by nucleotide excision repair, while double-stranded DNA breaks and covalent DNA crosslinks are going to be corrected by the homologous recombination. So the defects in this homologous recombination can result in 3 syndromes. Basically, Bloom syndrome, Fanconi's anemia, and ataxia telangiectasia. So all three genes, all three diseases are going to be autosomal recessive. In Bloom syndrome, the defect is in a helicase. Helicase is needed for winding and unwinding of the DNA. So during DNA replication and repair, you need this helicase enzyme. So helicase is going to be defective in Bloom syndrome. In Fanconi's anemia, Fanc genes are going to be defective. Ataxia telangiectasia, the ATM gene which is present on chromosome 11 is going to be defective. So all these 3 syndromes are going to have an increased risk of developing blood cancers and lymphomas. So leukemias and lymphomas are going to be common in this homologous recombination defects. So the next type of DNA repair is DNA mismatch repair. So while we are discussing about the genomic instability, we are already seen the DNA mismatch genes. So what is this DNA mismatch repair? So normally A nucleotide is going to pair with the T, while C is going to pair with G. But when there is a mismatch in this place, if you see, the C has paired with the A. So this pairing cannot happen. So this kind of proofreading is done by the MMR genes. So mismatch repair genes. There is a mismatch and it is going to be detected by the MMR genes, which are nothing but MLH1, MSH2, MSH6, PMS1 and PMS2. So as they are going to be checking the genome nucleotide one by one, they are going to be called as spell checkers of or proofreaders of the genome. So this MMR genes are the spell checkers of the genome. So whenever this MMR genes are defective, it is going to lead to the genomic instability. Genomic instability, always remember MMR defect leading to Lynch syndrome or HNPC syndrome. So Lynch syndrome was an autosomal dominant disorder. So what were the tumors associated with it? CEO, which is colon cancer, endometrial cancer and ovarian cancer. So HNPCC, there is not going to be any polyps, were actually leading to the genomic instability, right? So the genomic instability was not a hallmark, it is actually an enabler of tumor. Then there is another thing called as the cancer enabling inflammation. So these two were the newly added ones, right? So cancer enabling inflammation, the tumor cells are going to, it is going to influence the inflammatory cells as such, and it is going to make the inflammatory cells work for it. Okay, so this is what is called as cancer enabling inflammation. So what happens is they are going to change the inflammatory cells and make them release some proteases. So proteases are going to be released by the inflammatory cells. So these proteases help in detaching the tumor cells from one another. So like an E-cadherin loss, right? So they are going to degrade the adhesion molecules, and also they are going to help in degrading the ECM proteins. So that we saw in metastasis. So that kind of proteases will be released by inflammatory cells, and it will also make the inflammatory cells produce some growth factors which it can use to grow. So growth factors is going to promote the proliferation of the tumor cells, then make the inflammatory cells release VEGF, which is going to help in angiogenesis. Then make the inflammatory cells release TGF beta. So TGF beta is involved both in as an anti-inflammatory cytokine and also in EMT, which is epithelial mesenchymal transition. So epithelial mesenchymal transition, we already saw snail, twist, and now TGF beta. So all three are going to be involved in EMT. And as such, they are going to express the integrins and prevent anoicus. So anoicus was the form of cell death, which is a form of apoptosis actually, which is going to kill cells which are detached separately. So the tumor cells are detaching itself separately for metastasis, right? So in order to prevent those isolated tumor cells from undergoing apoptosis, that is anoicus, the integrins are going to be expressed by the inflammatory cells, which help them in attaching with the ECM proteins. Okay, so we had seen about the hallmarks of neoplasia till now.